Hi, I'm Dr. Bill Wyatt. I'm a general dentist. Uh, I've been doing nothing but orthodontics though since 1970, and I'm a member of the American Orthodontic Society, and this is an organization for general and pediatric dentists who do orthodontics, and our main purpose is teaching general and pediatric dentists or any other dentist orthodontics. We have a wonderful organization. We have an annual meeting and some excellent speakers at this annual meeting. We also have board certification where you work your way up, and if you pass the board to the American Orthodontic Society, you doggone sure know how to do orthodontics. And so this is a place you can go and learn orthodontics. I think it's the best place doing that. So anyway, I'm going to cover a thing called tongue thrust appliance. So many people have tongue thrusts. They have swallow problems and other functional problems, and they end up with a tongue thrust, and this pushes the teeth out of position. So I'm going to show you what we use to break this habit that people have. Jump down one. Now I personally like to band the lower four anterior teeth. I have a tremendous number of bands left over from time when we used to band teeth. I had an orthodontist that retired when he came and brought me his old band set, and so we've got a lot of bands there that we could put on lower anterior teeth. They're just that's the best thing you can use for it. And you fit 4 of these bands on the teeth, and then we're going to come and take an 030 wire. It's just a straight round 030 wire, and you spot weld that wire to the band right in here, and then you're going to flow solder over that, so it's really bonded on strong, and it's very difficult to break these wires off. Now we bend them, and I'm going to show you a bunch of things about it. From the outside we have bands that have slots that we'll line the teeth up with too, but that's not absolutely necessary. We try to get them straight across here and get everything going, and then we'll take these bands out and we spot weld this 030 wire. That's a 030 wire, and we spot weld it on. It's just a round stainless steel wire now, so you spot weld it real good, and now you're going to come in and flow solder over that, smooth that up. Now you'll come back and fit those into the mouth again. Now they look something like that when they're spot welded. Now we solder it and put them in the mouth, and as we put them in, we bend them so that the wire comes up and comes something like that. And when you cut them off, the way you cut them with it depends on how you make a sharp edge on the wire. Most time we'll come in and round them off just a little bit, smooth them off, but not too much. Now some people, they go ahead and push their tongue over them if they're too smooth and everything. I've had people come back and want you to put a point on them so their tongue would stop going over them. Usually those are adults. Now here it shows the bands with the solder on the wire. It's really, I mean, these things are attached to that band. It's hard to get them off of there, and that's the way you want it. Now, once in a while you break one off, and I've had a few people over the years maybe break one off and swallow it, but I've never had them catch or hang in the gut, and they go right on through. They don't get attached if they do swallow them. That's very rare, though. Over all these years I've had only, I could name them on 3 or 4 of them that have done that, and that's pretty rare. Now you turn them backward as you fit them. Now this is looking in the mouth from the back side. So when your mouth closes, of course you don't want these to hit the tissue or anything. You want this to be up there fairly close so that it's difficult for the tongue to go over the top of this, you see. It rakes the tongue on the bottom side, and this looks cruel. I mean, it does look real cruel, but it's not. It's funny how it does. You put these on a person, and they'll go up, and their tongue will be used to going over the top of this in this area, and it will rake it and kind of irritates it. And the tongue is quite smart. It may go back up there and hit it where it's been irritated before, and that irritates the heck out of it, and it stops going up there. It just will not go there. And you break this habit, and they stay in there for a long time, and they get to where they don't even notice them being there. That seems hard to say, but that's true. I had one adult lady who was a bad tongue thruster. I mean, like 40-something years old, and she was really embarrassed. She was pushing her teeth all out of position up in here, and so she wanted to break this habit. She didn't have any breathing problem, and she wasn't sucking her thumb or doing anything else like that, but she was tongue thrusting, and so I put them in, and she said, well, can you sharpen them? I had blunted them off for her. Well, I sharpened them, and she went home, and she called me the next day or two and said, that didn't work. My tongue went right over the top of them. Said, is there anything else you can do? So I said, well, I can put some on the top. And so we went in and bonded and put some on the upper teeth that came down and came in like this in between there. And now you've got a real hornet's nest in here. Right? If you put the tongue up there, any way it goes, it's going to get poked. And she called me back the next day or something and said, man, that worked. And my tongue went up there and hit that, and it stopped. And so we've had tremendous amount of success using these, breaking the tongue thrust. If you had the cause of the tongue thrust, you got rid of it, whether it was thumb sucking, mouth breathing, whatever. You've got to get their airway open, or you've got to stop the habit of lip sucking the lip in there and doing all sorts of things that causes tongue thrust, because the tongue can push the teeth out of place all over. Even with, I had a man 40-something years old, came in, he was about 44 something, and he had his bite was open, the front teeth were not coming in contact, he couldn't bite with his front teeth. He said, just a few years ago, my teeth overlapped, I could chew and everything. It had just nice looking teeth, and now they're opened up and the front teeth are sticking out. Said, we couldn't figure out how he did. I said, well, you're not sucking your thumb, you're not sucking smoking a pipe, you're not chewing on something and making this bite open like that. What could it be? And we couldn't figure out. I went on to another room. I was getting behind, and the lady stayed in there with him, and he came in to see me in just it's 10 or 15 minutes, and says, well, we figured this out. Says he tried to stop smoking, and for a couple of years he put these lozenges up in the roof of his mouth, and he tried to push them up there and hold them there with his tongue. And just that amount of pressure moved this adult's teeth way out front. And by the way, it moved the teeth and the bone. It didn't move just the teeth. It moved the teeth and the bone out. So we had gotten rid of the habit, but he was still poking the tongue in there. And we went back, and said, now we've got to stop the tongue. So we put this appliance in, and we're able to stop his tongue thrust. Here we've already talked about the causes of tongue thrust. This guy was having a tongue thrust, just trying to hold these lozenges up in the roof of his mouth, and it pushed the whole maxillary structure out of shape and pushed the teeth, and as it moved it moved the bone with the teeth, and that's something that's kind of hard for people to understand. You move a group of teeth out, the bone goes right with them. Now you got lots of other problems, the adenoids and tonsils and closing the airway and allergies and tongue thrusting and things that are just, so you got to get at the cause. If you get rid of the cause, you can break the habit. But if you don't get rid of the cause, you got something you can't handle. Here's a case. We'll just show a young girl that's doing this, and we have a little tongue thrust problem. And when they swallow wrong, they'll suck their lip in and kind of, you can tell when somebody's tongue thrusting if they pucker their lips up when they swallow. Normally, when you swallow, you have no activation of the lip muscles. They'll just be relaxed if the person swallows correctly. Anyway, this is not a real bad case of it, but here's the way the case looked here. Now this young lady has a breathing problem. She's got a large adenoid tissue that constricts the airways, pretty limited in here, and you can't see her tonsils on here, but she probably has some large tonsils in here, but they're down in this area. You can see them looking in the mouth, but I have very little success seeing tonsils on the cephalometric picture. And you can kind of just look at this child, and you can see they're just holding the tongue in the bottom of the mouth, and the air is coming over the top, and they swallow. When you swallow with a tongue thrust, you don't bite together. Normally, you have your thumb in your mouth and you swallow, you don't bite it either. And a baby or an infant that's nursing always swallows with a tongue thrust, you see. They don't bite when they swallow. I guess that's the way the Lord protects a mother. The child doesn't bite when it's nursing, and it swallows that way. But it's supposed to stop this when it's about 2 or 3 years old anyway. But if they put their thumb in their mouth, they got their thumb in here, they won't bite their thumb either, and they'll swallow the same way, and that's a tongue thrust. And the lips pucker up, and the tongue does a different thing, and the teeth reveal it. It just shows on the teeth. So you gotta get at the source of the airway problem. That's usually the thing that's doing it. And the allergies too also have an effect on it. All right, let's go ahead and see. We're open. Of course, you got something else nearly on every case. With this got a lateral tooth looks like it's out of place. The cuspid's coming in there. This is just regular orthodontics. There's no, you hardly ever get the case that nothing else is wrong. Once in a while you do, I think. But anyway, we put this on, and you can see these things down here on the bottom. We have a upper, what we call a 2x4, and a lower 2x4 wire on here with a couple of the deciduous teeth that are bracketed right like that, just to kind of stabilize the wire a little. And we'll go through and try to break this tongue thrust habit. And as soon as this upper tooth gets down in here, we'll line it up with this also. Now, let's see. Here it is a little further down the line. We put some more brackets on a few deciduous teeth and get everything lined up and try to maybe correct a little class 2 problem that this young lady has. And looks like she's aged 9 and 6 months at this time. That's her third Panorex that we've taken. Now here she is a little further down the line. She looks like she's this is 1988. That's her fourth Panorex. She's 10 now and 8 months. So now we go back to the pictures. So we put the 2x4 on the upper, and we bracket the deciduous molars, and we put a little arch wire in there that will open the bite and correct probably some of the class 2 problem right as we go along here. And I've got this appliance in there now. And there they are down on the bottom, and we'll leave that in there 6 or 8 months as they develop. We get the airway problem solved and everything, and we can break the habit. Now this is also used as occipital headgear. Try and lower the vertical on them. You can do a lot of different things as you use the appliance to break the tongue thrust. So here we connected up an occipital headgear that pulls kind of crossways on the head. Where you cut this little face bow right here that comes in. Let's see, we're going to have to discard that. Now we've messed up here, so I'm going to go back and pause this. Okay, sorry for the interruption here. Now, let me get back to the alright, we'll have to edit that part out. We've got an occipital headgear, and it's pulling on the brace, trying to raise the upper arch up as we go. Let me show it from the side. See, we actually cut this arm real short, and it's connected to the teeth right in this area. And as you pick up on this, right here, you can elevate the front teeth if you cut it real short. If you cut your bar further in here, damn. Okay, this is an occipital headgear we've got in here to kind of help elevate this as we go up with it. That's a blurred picture. Alright, the headgear fits back in the molar area back here, and it has a face bow in the headgear. Goes around this way. Have this little welded on piece that plugs into the headgear, and you put that right between the upper centrals, and as you wear this, it picks up the upper centrals, and you can cut these bars out where they're kind of short across here, then it'll tend to elevate this portion. If you cut the actual bars way down further here, you can elevate the arch in this area. This occipital headgear is an excellent tool to use to help lower the vertical dimension and to elevate the arch in there. So it's a good tool to use. Now, this is 5 of 88, and we have pretty well elevated that. I think we're just doing we put a retainer in the mouth and hold it what we've got, and we'll come back and finish the case up later on. This will be the first phase of the case, and we've broken the habit and things look good, and we can come back and finish this up when we lose the deciduous teeth. So that was the first phase of the treatment. Now everything's lined up good, and we'll just wait and we'll finish it up. We may not need to do much, but when she gets all the permanent teeth in there, we'll come back and finish it. Now, you can put these little fingers on a lingual arch if you want to. So we got this kid that's got an open bite where his tongue thrusting and sticking through there. So we put a lingual arch in. You band the 6-year molars back here, put this arch in, and you solder these wires onto the arch wire, the lingual arch, and sharpen them, do the same blooming thing with it. It breaks the habit, and so that's just another way that you can put something in the front of the mouth. Now, a lot of times people don't want to get all this wire, so they bond little pointed pieces of acrylic or composite in here and on the backs of the teeth, but to me they're not near as efficient as the wire fingers are. There they are, look at that. And we broke the habit, and the kid stops poking his tongue through there, and the teeth will come down. And while you're doing that, you can spread the arch out and jump the crossbite. Usually this is not a unilateral thing. It's off about as much over here when you get it over on this side. This is the jaw center back of it. There's the center line of the bottom. There's the center line of the top. It'll center back up, and then this will break that problem. That now here the kid is later on down the line, and you see the midline's pretty well lined up. Let me back that up again. See, the center line is slightly off, not very much. Here's an adult that has a tongue thrust problem, and the next 3 cases we're going to show adult, and we'll show this young lady had a tongue thrust problem, and she's got a gap between her upper front teeth. And so here we put braces on the young lady, and then added these fingers on the front, and have this goes up in here, underneath there, and stop the tongue. We got her breathing correctly, got rid of any causes and everything, and we put this in, kept it for several months, closed it down, and took it out. And here's what it was when we started. It's 1977, and here's 78. And the teeth are down, and they stay down if you get rid of it. Now this young man was a physician, and he came in. He had his teeth straightened by a fine orthodontist in our area, and I knew the orthodontist. He did excellent work, and his teeth had gotten all out of shape simply from the tongue thrust. I mean, this is the way they were. This was 1977, and he's got this huge overjet, you see, and spread these teeth out. Just looking from here, you can't see that much overjet. It doesn't look that bad. You see it from here, but you see it from the side, you'll see it. So we'll rig this up, put it on his mouth. He had an extraction in the case, finishing him up. So we put this in with these little fingers, see down here, and when we did, I told him, I said, now you're a doctor. I want you to tell me exactly what your tongue does and everything, and how it reacts to this. This was back in the days before we started wearing gloves. You notice I got a bare finger in there. So anyway, he came back and told me, he said, my tongue went up there about twice and hit that, and then it just stopped going up there. And he wore that for quite a while, and we broke that habit, and his teeth straightened out. And here he is during the treatment, where we used some class 2 elastics. I put a lower lip bumper because he had the toughest lower lip you ever saw. I mean, he had swallowed so many times wrong, and his lip was just really tough. I mean, and you put a lower lip bumper, and it'll take this lip force. It doesn't actually touch the tissue back here, and it goes back and has a little expansion loop, and it goes into the molar. Now you take the lip force that he was using here, push it back against the teeth, and now you come off with a class 2 elastic. So in essence, you take the lip that's overdeveloped in here, and you take that force and push the front teeth back. It works really good. So you got to learn how to use these lip bumpers. We try to show you how to make those, and you can put them into the auxiliary tube on that. Let me go back to that picture. Okay, and that pushed that back and kept it that way good. Here he is at this time. Now that's the trick in doing it on adults. So you gotta use your imagination on some of it. But lower lip bumpers are excellent. The occipital headgears are excellent. So we finished this guy up. Now this lady came in, and she had a terrific tongue thrust problem, pushing her teeth out. Now she's a school teacher, and she's a very strict school teacher, I'm sure. She is all business, you know, and boy, if this thing didn't work, she would have been back. Now, when we finished her out, we corrected the cross bite and everything, and then we moved these teeth forward. We had room enough to put these teeth in here too, as we expanded this arch. This was 1982 when we saw this lady. And looking at it from the side, you can see the whole thing raised up. Now the tongue moved these teeth out. As the teeth moved out, the bone structure went with the teeth. And that's what I want people to know. And if you move the teeth to the side, and you take this whole group of teeth and bring them out to the side, that bone structure goes with those teeth. It doesn't push the teeth out. That's why people think when you don't have bone structure, you go in there and got to do surgery on the jaw here to move the bone out so you have some bone for the teeth. The teeth will carry their bone with them as they go out, and I've pretty well shown that through the years. Now, we pushed this in, and she wore this thing, and it brought her teeth out. Now the midline is off slightly, but if she's got good interdigitation on each side, I don't worry about the midline. Maybe some discrepancy. It may not be ideal all over, but this was 1980, looks like 84 there. Alright, it's good interdigitation over there. It must not be on the other side. Something is off in there, the midline. Oh, I take this back now. What we did on this lady, we didn't have room enough for those teeth to come in. So I took out one lower central. Now this is a cuspid, and this is a cuspid. This is a lateral, and the one central left is right in the center of this. I forgot all about that when I was telling you about this. So it is interdigitated well on both sides. But I took one tooth out because when these were interdigitated back here, and these teeth were setting edge to edge out here. So we removed one central. We took one central out and put that one in the center, and it balanced out perfectly fine. Now that was 84, and this lady came back. I saw her years after we got through with this case, and that's 2000 apparently. I got the name marked out, but the date is still on there. Maybe the next one will be better. Alright, there's the retainer we wore, and this was 10/23 of 2000, and that was 83. So when we had finished her, so it's about 17 years, something like that, in there. And that's the end of our deal on tongue thrust. So let me go in here and see if I can